Hello, everybody. I am Dr. Sandeep Goel. I am an interventional cardiologist at Chandigarh Heart and Multi-Speciality Hospital at Sangrur. Today's topic is on pedal edema and chronic kidney disease. Today, we will explore what pedal edema is, its causes, how it relates to CKD, and the best ways to manage it. First, let's see what pedal edema is. Pedal edema is a condition where extra fluid accumulates in the lower legs and feet, causing them to swell. This swelling can happen for several reasons, such as heart problems, liver issues, thyroid issues, kidney problems, or blood clots. Our body fluids are divided into two main areas inside our cells and outside them, that is, in the vessels. The outside area includes the space around our cells and inside our blood vessels. Edema or swelling occurs when there is a problem with how fluids are distributed between these areas. This problem can happen if too much pressure builds up in the blood vessels, often due to heart issues or excess fluid. It can also occur if there aren't enough proteins in the blood, like albumin, which help keep fluid in the vessels. Additionally, the lymphatic system normally helps move extra fluid and proteins back into the blood, but if this system isn't working properly, fluid can build up and cause swelling. The kidney plays a crucial role in regulating the body fluid balance. The kidneys help remove waste and regulate fluid. When they are not functioning properly, fluid can accumulate, leading to edema, as seen in CKD, acute kidney injury, and nephrotic syndrome. Edema is one of the major symptoms of CKD. Let's explore how clinicians approach the diagnosis of edema. First, a detailed history helps identify risk factors and underlying conditions like heart failure, kidney disease, and thyroid disorders. Edema can be generalized or localized. Generalized edema, this type affects the entire body or large areas and is often linked to conditions such as heart failure or kidney failure. Whereas localized edema, this type causes swelling in just one area of the body. It's often due to inflammation, blocked lymph fluid flow, or issues with blood flow in the veins. During a physical exam, clinicians look for pitting edema, indentation after pressure indicating heart failure or nephrotic syndrome, non-pitting edema suggesting lymphatic obstruction or hypothyroidism. In the case of renal disease, the following lab tests and imaging are helpful. CBC, renal function tests, urine analysis, urine microalbuminuria, and urine albumin to creatinine ratio, as well as an ultrasound of the abdomen and pelvis. A thorough history and physical exam are key identifying systemic causes and specific signs guides the management plan. When it comes to managing edema, the approach depends on whether the cause is local or systemic. For local causes, non-pharmacological treatments are essential alongside addressing the underlying issue. For systemic causes, a combination of general measures and targeted treatments is needed. For local edema, non-pharmacological measures like limb elevation, regularly elevating the affected limbs helps reduce swelling. Compression therapy, wearing compression stockings can assist in improving blood flow and reducing edema. Physiotherapy, massage and other physical therapies should be performed by trained professionals. Ice application useful for severe or congested edema and cases of cellulitis. In case where systemic causes are at play, such as in CKD treatment, focuses on reducing fluid retention and addressing the underlying condition is important. This involves salt restriction, limiting salt intake, helps prevent fluid buildup and manage volume overload. Diuretics, these medicines increase urine output to help manage fluid levels. Different types include loop diuretics, example furosemide, torsemide, often preferred for the effectiveness and longer duration of action. Thiazide diuretics, metolazone, used adjunctively for enhanced diuretic effect. Potassium sparing diuretics, spironolactone, used cautiously due to potential risks of hyperkalemia. The choice and dose of diuretics depend on factors like the severity of edema, the patient's hemodynamic status, and kidney function. It's important to use diuretics cautiously to avoid complications like hypokalemia, hypotension, and electrolyte imbalances. Regular monitoring of fluid volume, urine output, blood pressure, weight, and periodic tests is essential. In chronic kidney disease, managing edema often requires salt and fluid restriction, essential to control fluid retention, high dose diuretics, as kidneys are less functional, so we need higher dose of diuretics to make uh, to produce more urine from the dysfunctional kidneys. So loop diuretics like furosemide are usually effective, but thiazide diuretics can be added if necessary. Managing edema involves a tailored approach. For local causes, non-pharmacological methods are key, and systemic causes require dietary adjustment, diuretics, and close monitoring. Patient education is crucial. Understanding the condition, following the treatment plan, and making lifestyle changes can improve outcomes. Early recognition and effective symptom management help prevent complications. So join us in recognizing National Edema Awareness Day on September 25th to increase awareness and promote early detection of edema and related conditions. Together we can manage and understand edema better. Thanks. Thanks for watching.